Welcome to the Metropolitan State University Bloodborne Pathogens Training. My name is Daniel Holcomb. I'm a environmental health and safety consultant to the university, and I'm also the acting campus EHS person as well. OSHA requires site-specific training for employees identified in the plan. All of you viewing this training have potential exposures to blood or other potentially infectious materials in an occupational setting. So we do have a quiz at the end of this presentation for documentation of training. So please click on that link at the end. You are receiving this training today because your job position was identified in our exposure control plan that has duties that have potential exposure to blood or other potential infectious materials, which is also called OPI. So Minnesota OSHA requires that the employer has a bloodborne pathogens plan in place. And that we provide training during the initial job assignment and annually thereafter. So the university does have an exposure control written plan that's required by OSHA. So the plan is reviewed annually and updated as needed. The plan is available for anyone that wants to see it by contacting myself at the email address listed. Also, we do have a copy on the shared drive, which shows the address there. So according to our exposure control plan, copies must be in the dental clinic, nursing simulation lab, human resources office, campus operations office, maintenance office, and library main desk. You should be able to print off a copy on the shared drive, but if not, let me know and I can bring you a hard copy to have posted as well. So the exposure control plan must cover these bullet point items. Evaluation of employee activities, that's what we have done. That's kind of why we have the job positions in there for who's required to be in the program. Designate a program administrator, that is myself, Daniel Holcomb, campus EHS. Practice universal precaution, which means that to treat all blood as if it is infected with a bloodborne pathogen. We'll discuss more about that later on. Hepatitis B vaccinations, this is for anyone that's a part of the program is offered the hepatitis B vaccination at no cost to them. We'll discuss more about that as well later on. Post-exposure procedures, what to do in the event of a bloodborne pathogen incident. You come in contact with blood, what do we do from there? Personal protective equipment, the type of equipment that's needed for different job positions during cleanup or for protecting themselves. Training, review, and then record keeping. All these will be discussed later on in the PowerPoint. So this standard covers all employees whom exposure can be reasonably anticipated as part of their normal job duties. It's a very broad statement. This is actually listed as it is in the standard. So we did our best to evaluate the potential exposures per job positions. If you have any questions or concerns, please feel free to reach out. These are the job duties that have been identified in the program. So these individuals could have potential for a bloodborne pathogen while doing cleaning or doing maintenance, needle stick potential and exposure during clinical work, cleaning up broken glass or other sharps, or could be due to attending incidents and overall blood cleanup. So a bloodborne pathogen is an infectious microorganism in human blood that can cause disease. Pathogens are spread through contact with body fluids. And then OSHA requires that we discuss the most common bloodborne pathogens, HIV, hepatitis B, and hepatitis C. So the modes of transmission could be due to the exposure to another person's blood. This could be blood contact with non-intact skin or mucous membrane. So this could be blood contact with dry skin, with an open wound, or a splash into the eye. Contaminated sharps and glass, contaminated needle sharing. That's why it's important that we're not cleaning up contaminated broken glass or sharps by hand. We're using a broom and a dustpan, making sure that we are getting those needles put into a sharps container. But also can be due to sexual contact and infected mother to child. B is defined as inflammation of the liver. It is a contagious liver disease. It can start as an acute disease, and it can be cured or become chronic. So the acute onset is going to be sudden and sometimes go away within weeks. Chronic can be the disease that persists over a long period of time. And as of December 31st, 2018, there were 25,000 people who were assumed alive and living in Minnesota with hepatitis B. So 2018 is the most updated numbers provided by Minnesota Department of Health, and CDC estimates between 850,000 and 2.2 million people are living with the hepatitis B virus. So this graph shows the number of acute cases per year for hepatitis B, C, and HIV. The increase in more recent years, such as 2016, is due to the reclassification and inclusion of asymptomatic persons. This is showing where people in Minnesota that are living with hepatitis B are located. So this is showing the number of cases of chronic hepatitis B based on age, and chronic hepatitis B is defined as a person infected for longer than 6 months. So symptoms of hepatitis B for an acute infection is going to be fever, fatigue, loss of appetite, nauseous and vomiting, abdominal pain, dark urine. So a lot of these symptoms are going to be like flu-like symptoms. So that's why it's important that we always are reporting any sort of blood incidents that did occur, so we can track those to see if they are progressing into something that's worse than the flu. So chronic infection, most individuals do not have any symptoms for decades. When symptoms do appear, it's usually during an acute infection. So hepatitis B vaccinations are offered to anyone that's in the program at no charge. And these are usually given as 3 doses over 6 months. There is one type of vaccine that is 2 doses given a month apart. So the vaccine is administered into the deltoid muscle. So more than 90% of healthy adults develop adequate antibody responses to the vaccine. And the effectiveness does decline with age, such as around by age 60, 75% of the vaccine develops protective antibodies. And booster doses are not usually recommended for people with normal immune status, but this should be discussed with their doctors as well. So the vaccine is safe, and soreness is a common side effect, but please speak to your medical provider if you have any additional questions or concerns. Some benefits will be that it protects you from the hepatitis B, which is a serious disease, protects others as well, prevents the development of liver cancer and disease, and it does keep you from missing work. Every employee in the bloodborne pathogen program is required to fill out a hepatitis B acceptance declination form. This will be emailed to everyone, so please fill it out and send back to me at the Metro State address right there. And you could always change your mind throughout the year or throughout the years if you do want to change your status. We just need to have one form on file that states that we did offer this shot to you, a series of shots to you. So you can always send me an email later on if you want to change your status. An example of the form is on the next slide. So the left form is the hepatitis B vaccination consent or declination form. This will be emailed out to you. So if consent is provided, we will provide an authorization form, which is the right form, to my medical clinic in Maplewood. The clinic does take walk-ins or by appointment, and it is open Monday through Friday from 9 to 5. Hepatitis C is like hepatitis B, which is inflammation of the liver. It becomes chronic illness in approximately 70 to 85% of infected people. An estimated 2.7 to 3.9 million people in the U.S. have chronic hepatitis C. There is no vaccination for hepatitis C, unlike hepatitis B, but there are medications available to help treat hepatitis C, and these are antiviral medications intended to clear the virus from your body. So of every 100 persons infected with hepatitis C, approximately 75 to 85 will develop chronic infection. 60 to 70% will develop chronic liver disease. 1 to 5 will die from the consequences of chronic infection. And as of December 31st, 2018, there were 33,000 people who were reported to MDH and assumed alive and living in Minnesota with hepatitis C. So this shows where people living in Minnesota with chronic hepatitis C are living. This graph shows the number of cases of chronic hepatitis C in Minnesota based on age. Symptoms of hepatitis C for an acute infection are going to be fever, fatigue, dark urine, clay-colored bowel movements, abdominal pain, loss of appetite, nauseous. So very similar to what the acute infection was for hepatitis B and also for like the flu. So that's why it's important to always report all incidents so we can track these throughout the years to verify that it was not a bloodborne pathogen virus that was developing. And lastly, we'll discuss HIV/AIDS. So HIV is human immunodeficiency virus. AIDS is acquired immunodeficiency syndrome. Over time, HIV attacks and weakens the immune system. That increases the chance of opportunistic infections. So this stage of the disease is called AIDS. There is no known cure for HIV or AIDS, but there is medication that can help slow the progression of the disease. And people can live typical full lives now with this medication. The CDC estimates 1.2 million Americans are living with HIV, and as of December 31st, 2020, 9,500 persons are assumed alive and living in Minnesota with HIV/AIDS. It shows the new HIV/AIDS cases by year in Minnesota. As you can see, it's been dropping ever since 2016. And this could be due to the awareness of the virus and helping people understand how to protect themselves from it. So this slide shows HIV diagnosis by county of residents in Minnesota in 2018. Overall, there was 226 cases, and 89 cases of those were from Minneapolis-St. Paul. So methods to prevent or reduce exposure could be administrative controls, which includes training, vaccinations, and then risk assessments. Sharps precautions, so such as having those sharps containers in areas that do have exposures, so they are easily accessible to people to place in them. Making sure that people do not recap needles. That's important that that's in the common way of getting exposure based off puncture. So PPE is another method for reducing exposure. So whenever there is a risk, we need to wear PPE. This is going to be most importantly gloves, but if there is larger spills, maybe glasses, goggles will be involved to reduce that splash factor in the mucous membrane. So PPE must be readily accessible. We will have spill kits located in all departments that are listed in the exposure control plan. So please send me an email if there isn't a spill kit in your area. Kits are currently located with the janitorial service and maintenance. The engineering controls are also included with like sharps containers and proper hand hygiene. So hand hygiene eliminates the pathogens from the worker's hands and down the drain and out of the workplace. Hand hygiene must be used after removal of gloves, whenever you leave the work area and go on break or before eating, and following contact with blood or OPIM. So it's important that we exercise universal precaution at all times. So this means to treat all blood and blood products as if it is infected, because we don't know if that blood is infected with a bloodborne pathogen. So we always wear gloves when handling injuries, blood and or blood products. When possible, allow the person to self-care because the person can't obtain a pathogen if they already have it. Then first aid kits are located throughout campus. So if you need a kit in your area, please let me know, but there should be one around your work area. And these kits are meant for small cuts. These materials are used to prevent open wounds and transfer of blood to others or objects. Anything beyond first aid by self-care should be administered by a trained medical professional. So the following are examples of PPE that can be worn while cleaning up spills, and that will be included in your spill kits. So gloves, most commonly made of nitrile. It's important that we are covering our sores or cuts with bandages before we are putting on gloves. Important that we are inspecting the gloves before use because gloves will break down over time. Do not use a damaged glove. Take gloves off carefully when you are done cleaning up. Making sure that you are not transferring any sort of blood on the glove onto your own skin. And then disposing of this properly. So if there is blood on PPE, make sure that we do put this into a red biohazard bag or a zipper bag for me to be able to dispose of it as regulated waste. These red biohazard bags will be included in the kits as well. An apron could be used for a larger spill, but if it is getting to this point, we probably want medical authorities taking care of this anyways. But eye protection, face shields, goggles for the risk of splashing into eyes, paper face masks, CPR masks if we are doing any sort of CPR, and then booties as well, so we don't track this throughout the floor, throughout the campus. Take those booties off. But then again, those booties are going to be for a larger spill usually, which would probably require us to have medical authorities on site to help with the cleanup. So even the best gloves will break down over time, so it is important that we are doing our glove inspections before donning a glove. This is for checking for any cracking, shrinking, discoloration, holes and punctures in the glove. So in the event of a bloodborne pathogen exposure event, we need to wash the exposed area with soap and water for at least 15 minutes, irrigate the eyes with water if necessary, report the exposure to your supervisor as soon as possible so we can also track that exposure event, and then contact campus operations and myself for a post-exposure packet, and we can assist with helping filling that out as well. So in the event of a blood spill cleanup process, we need to use our gloves, don all the PPE that's required, use disposable towels to absorb the spill, clean the spill area with soap and water, and then lastly, use a proper disinfectant and allow the dwell time to settle for to properly kill the virus. And then dispose of waste in the proper containers. So those disposable towels to absorb the spill will most likely have blood or OPIM on them that could transfer from one object to the other. So if that's the case, then we need to have those disposed of as regulated waste, which we'll discuss more in a later slide. But janitorial contractor is responsible for most cleanups whenever possible. So make sure to get them on board and notified of any spills. It's important that we disinfect all surfaces, tools, and equipment that come in contact with the blood or OPIM. Iron must be disinfected or disposed of properly. So for decontamination of tools and PPE, place all these into a bucket and use the proper disinfectant and require the proper dwell time to kill the virus. Contaminated items that would release blood or OPIM in a liquid or semi-liquid state, if compressed, must be disposed of as regulated waste. So these will be disposed of, similar to like how our sharps and hammers are disposed of. And then items caked with dried blood that are capable of releasing during handling as well. So regulated waste must be disposed of in a red biohazard bag, or have it disposed of in a red biohazard bin, which we do have, and that's where we place our contaminated sharps as well. The best practice is to double bag, so it does not get a hole or something that does allow it to be exposed to a different surface. And then contact myself if you do have a red biohazard bait that needs to be disposed of, and I can gather that and place it in a storage area for it to be picked up by our disposal company. So medical records and exposure incident records are going to be kept on the file for the duration of your employment, and then also 30 years thereafter. And the reason why the 30 years thereafter is because if you do have some sort of developed chronic illness, we could always go back to that exposure event that occurred, 20, 10 years prior. So if we only kept that for a couple of years after your employment, we would not have that record anymore of exposure event. Sharps logs are kept for 5 years beyond the completion of that calendar year. So in the event that there was a Sharps incident, we need to have that on a separate log as well for confidential purposes. And then training records will be kept for 3 years. I want to thank you all for attending the training. My contact information is listed on the slide. Please feel free to reach out to me with any questions. The quiz link is also attached to the slide as well. It's a 7-question quiz for training documentation, and you'll be receiving that acceptance declination form through the email through myself or Nancy Tyndale. Please send that back to me at the Metro State email above. Thank you all. Have a great day.